So we have a patient with both a left hip ulcer as well as a sacral ulcer. She's in a Clinitron bed, which is basically an immersion bed with sand. It's a group 3 mattress, which we've discussed in previous videos. We're checking that it's on. It's much easier to turn the patient while she's on. I'm asking the husband, who's very lovely and very involved, how she's doing overall, and he says she's doing much better. She's eating well. While we're turning the patient with the bed on, I turn the severely to one side, and then I have the caregiver turn the button. It's much easier to dress the wound after we've turned her with the bed off, meaning the sand is no longer flowing. This caregiver is fabulous, was on vacation. She doesn't know how to use this bed, so she was not appropriately trained, which I'm going to try to show her how to do to both the husband and she. The company, Ethos, does a great job of maintaining the bed, but sometimes they don't have the most practical ways of teaching the caregivers and the team of how to turn the patient with the bed on, which we're doing here. Right here, she has a sacral ulcer that is healed. It was significantly large. It was approximately 4 centimeters, about 5 centimeters before I started treating it. It was very difficult to manage both ulcers without a Clinitron bed because it's very hard to turn a patient every 2 hours from side to side and off the sacrum. This bed made it much easier. We were able to heal the sacral ulcer. Right now, we're making sure that we have a clean area to work. I use lots of chucks or disposable pads, which I'm putting underneath the patient. As you can see, the lighting is very good in her apartment. I don't need a headlight for this one. I'm removing what's called as an opsite. This is a waterproof dressing. She had major skin irritation from all the adhesive. The opsite tends to be very good. This hip is a chronic ulcer. We've debrided. I've actually tried to close it. It is much better that she's on this bed. However, there's some involuted wound edges, meaning the skin edges are turning in. We talked about in previous episodes of the wound edges of the boy's looking down his feet. He can't kiss the girl, meaning the skin edges won't come together. So I'll have to debride those edges to stimulate new tissue growth. When the skin is going down, like I'm showing with my hands, it will tell the body that the wound is healed, which it's not. So I'm explaining during our next visit, we'll debride the edges as well as the center of the wound to stimulate new angiogenesis and good inflammation, as well as remove those borders with the involution where the skin is turning inwards. Overall, the tissue bed itself looks very good. It's extremely pink. I'm explaining to the husband and the caregiver how this works, why there's involution, why it's impeding her wound. Yeah. The husband doesn't realize that I'm actually videoing his wife, which I've explained to him right now, that I have a camera on my head. We're using a collagen-based material, which is Prisma, which is a matrix, and we're looking for gauze. Normally, I have everything laid out in advance, but because the caregiver came back, she didn't have everything set up for me. But it's my responsibility as the healthcare provider and the plastic surgeon to have everything laid out. I'm switching gloves as I normally do after I've cleaned the wound. I normally use skin prep or some sort of material. There's some bleeding on the gauze, which you note. It's nothing to be concerned about. That means there's healthy bleeding tissue at the center and the base of the wound. The caregiver is helping me with the gauze. This is where it's important to have a team effort. I need to do a better job of having more chucks and be a little bit neater in terms of my wound care setup. I'm asking the caregiver and the husband how it is to manage the bed. They say there's some challenges. It hurts the people's back. We're trying to get risers, which are special like platforms to put underneath the bed. Because it's an apartment complex, they don't get the standard model of Clinitron bed, which where you can adjust the height. This one's a little bit more challenging. So we're begging the company to provide risers so it's not hurting the backs, but I'm trying to show the caregiver and the husband how to really use the bed appropriately to limit any back strength. I think it's easier to turn a patient in this bed as opposed to a regular bed, but you have to know how to use the sheets and draw sheets correctly to turn the patient. A lot of people are not shown how to do this, but we're making better efforts to teach the family and the caregivers. I'll provide videos as well as an instruction on how to do this. The company is great, but they don't show instructional videos. Right here, I put several layers of Prisma inside the wound, as you can see. I normally don't put this much in, but because it's a little bit deeper, I'm using separate layers. After this, we will use gauze. I normally use collagen products such as Prisma or Epiona for these chronic wounds when they're not draining much. I don't use it for heavily draining wounds. You're not supposed to use collagen products for wounds that have heavy drainage or exudate, what we call it. We've done different dressings such as hydroferro blue. I stopped using hydroferro blue because it made the wound edges very wet and macerated. We were originally using Aquacel AG as well as alginate products. right here, I'm trying to figure out what to use as a secondary layer. I'm putting a little piece of Aquacel AG. It will absorb any further drainage, actually as a nice buffer, followed by a layer of gauze, and then an opsite. I prefer Tegaderm, but the company provided opsite. Opsite's a little bit trickier to work with than Tegaderm. Just you have more flexibility with the Tegaderm. They're both waterproof dressings that are secondary dressings. They're great for people that have allergic reaction to adhesives, such as this patient, as well as many other patients. I routinely use Tegaderm or these type of waterproof products like Vac drapes or other things because they're excellent in terms of keeping moisture, urine, as well as feces out, as well as not being rough on the skin. They actually use this similar tape to this for allergy testing. And that's it for the dressing. Sometimes I have to reinforce it with my own Tegaderm that I use. I'm just discarding all the refuse, and the caregiver is fantastic in helping me. And that should be it for the wound care. We don't have to dress the sacrum other than with Triad. I'm just reinforcing it with a Tegaderm that I always bring with me. And I'm giving them reassurance that the wound is doing okay, but we'll have to do a surgical debridement during next visit. That's the last piece of Tegaderm. We're discarding all the other refuse.